When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Hello and welcome everyone to the Mendocino County Friday Update. My name is Cameron Brown, and today we're very happy to have Mendocino County Health Officer Dr. Andy Coren back with us. And we'll get the latest COVID-19 updates for the county from him. Then we'll move into taking some questions from local news media. And I believe we have 6 outlets with us here today. And then we'll hopefully have time to be taking questions from the public via Facebook or YouTube. So we'll be checking there as well. So let's jump right in. I will hand things over to Dr. Coren.
Thank you, and hello everyone. So recently, as you can see, the case numbers have been rising at an alarming rate over the last 2 weeks. The last week, hospitalizations have also accelerated, challenging our capacity. And this week, we're seeing a few more deaths. So I'm just going to give some breakdown first nationally. United States, if we can have the first slide, leads the world with almost 67 million cases. Next slide. And 853,000 deaths in less than 2 years. It's now over 100,000 or more per day. This is 4 times last winter's peak, and it's broken all prior records in cases, and hospitalizations may be following. So you can see on this slide, green is the United States, and you can also see this notch here that I'm going to get into in a minute. It looks like we may have reached a peak nationally, so we'll get into that more. The next slide shows several states showing the case numbers decreasing over this weekend. Rhode Island, the one in the top middle, has been the record holder, is the highest, and it went very quickly up. You can see that, and I don't have all of the states represented here, but the Northeast was clearly the leaders in this pandemic. And then it came down to the in Rhode Island, and in some of the other states, you're seeing it in the Midwest. But here on the bottom, second from the right is California, and you also see the red line is the number of cases shot up very high, and it looks like it's coming down a little bit, also very steeply down. And I'll show you the comparison to that in other pandemics that we've suffered. The industries have been overwhelmed by absences due to sickness, and supply chains are challenged around the country and the world. And in California, on the 18th, the LA Times reported 1 million cases, up 1 million from the previous week. That was quite a record. And if we can have the next slide showing the case rate, it exceeded the level of last winter. This is from the California. The current peak is considerably more than you can see in the early part of January and the end of February and the end of December in 2020, 2021, when we had our worst surge in California. Ours is significantly greater than that. The surge that we suffered most in Northern California was in September, August, September, part of October, was considerably less comparatively for California. The other thing to note from this is that these cases are undercounted. There are less reported tests because we're using antigen tests an awful lot more, and the holidays came in that period of time. There's been a backlog of PCRs, and so this last leg down may not be as deep. This is the more uncertain part of the curve on all of these graphs because the data is not complete. Modelers at the CDPH, however, believe that the peak in California did occur in January 4th, but the rural northern counties are lagging. The California test positivity is down now to 21.1, and that represents cases, but it's down from 23.1 just a week or so ago. If we go to the next slide, we should look at hospitalization, and that of course follows cases. It's decoupled, so as the cases are going up and then coming down, we're seeing that the hospitalization data is still going up. It may be slowing. The numbers of hospitalized people have tripled since Christmas, but in the last week, it's been only a rise of 50%. So it may be lower due to a lower virulence of Omicron, which has been shown in several studies. The percentage of COVID in the hospital and the ICU is increasing, and the increase in hospitalizations is happening first from the south and then moving up through the northern states and then the west. Noteworthy in this pandemic is reinfection is significantly higher now with Omicron. And also the death rate in the state has not yet risen significantly. So it is rising, but it's not as rapid a rise as we see in the cases or in hospitalizations. Deaths, of course, follow hospitalizations, but also if our hospitals are full, there was going to be more mortality from COVID as well as other illnesses. So let's move on to Mendocino County data. The case rate on January 21st, actually, let's hold off on this slide, just move it to the next slide. On January 21st, we had 141 new cases. This quadrupled since Christmas. There has been underreporting and late reporting, as I said, because of issues with reporting platforms, lab processing, and also thousands of antigen tests that were done through the schools. Pharmacies are selling them, and Department of Public Health also distributed them. You can see that on this slide, the average cases by week compared to prior surges, of course, again, it's significantly higher. This red bar on the right is the second week of January. When we look back in August, September, which was our last surge, it was significantly less. But you can see that the current surge really started at the very beginning of January, and it's continuing now. You can see on the next slide, which shows, okay, this actually shows the evolution of Omicron. So all of this red was Delta in terms of the whole genome sequencing, and the little strip on the upper right here is the beginning of Delta in our county. We had a couple of cases positively identified toward the end of December. And I think that there should be another slide in there. Can you move to the next slide? Let's see if it's there. No. Okay. So those are variants. The statewide public health has shifted, though, in terms of contact tracing each person personally to to focus on people less than 18 years old, over 65, people in nursing homes and other congregate care settings, schools, and shelters. And we in the county have also followed this method. Other positive cases that are outside of those groups would get an automated call, a virtual assistant call, and should not expect a personal call. They are told to isolate and notify their close contacts that they should test and quarantine, and they are welcome to call the call center for questions. If outbreaks are expected by enterprises, they should call the call center to discuss the outbreak response from the county. And also, if people need shelter or other services during their quarantine or isolation period, they do need a PCR test to be eligible for those services. But if their need is very urgent, they can have their provider give us a call. We currently have 32 people in shelter. Testing has gone up. We're still not there yet. Testing has gone up to over 800 per 1,000 per day. And this is not counting antigen testing. So the PCR test positivity is reliable, and it has gone up to 20.5%, tripled in the last 2 weeks. By comparison, the California rate went from 3.3% at Christmas to over 22.4%, but now it is decreased in the last week to 20.7%, which is another reason why we're saying we probably passed our peak. Mendocino is also using over-the-counter testing as mitigation for the surge. So the schools have distributed 12,000. The county has distributed over 12,000, and we're all trying to get more. There's a lot of demand for those antigen tests because they're rapid and they're very accurate if it's in the early days of your infection. We're getting more from Department of Public Health, and these probably won't be large numbers, mostly directed toward the clinics. Individuals can order them online at all capitals, COVID tests with an S at the end, covidtests.gov, and apparently they'll be allotted 4 per household. It is taking a while for that request to go through and the mail to come out. As of January 15th, most insurers will have to pay for up to 8 commercial tests per month per covered soul. But I would confirm that with the insurance companies. Most are doing this by reimbursement, as I understand it. So a person will have to shell out the money from their own pocket and then be reimbursed by the insurance company. Remember, those over-the-counter tests are for the community to be able to protect themselves. If positive, isolate and call the call center for any further assistance at 707-427-2759. Reporting is recommended, and we appreciate that because it helps us track what's going on in our community. But for the most part, we really want people to use these results to decide whether they should go into work or to school or to a party that may be coming up. So moving on to hospitalizations, on January 20th, we had 25 inpatients, including 2 that we were caring for from hospitals out of town. 2 of our hospitals are reporting staff shortages. The available staffed ICU beds as of last night was 2 out of 16 generally licensed. And in Mendocino County and California, most of these beds are occupied by non-COVID patients. COVID-caused deaths in Mendocino County have gone up to 111. Outbreaks as of January 19th included a fairly large outbreak in the jail, and this has included a number of staff that have recovered and also inmates that are recovering. Ford Street and Building Bridges have been affected by outbreaks, in the Ukiah Co-op, which briefly closed down, cleaned itself up, and they are moving forward. There's been a lot of questions about schools, and I want to restate that over the entire pandemic, in the schools, there have been 45 exposures, but only 3 outbreaks where the exposures were linked to contact within the schools. And those all happened before Christmas. Since the return from the holidays, no outbreaks have been confirmed in the schools. That is, no in-school transmission, although hundreds of students have come in, and because of those over-the-counter tests that were distributed by the schools, hundreds have come in and were positive. And of course, they were not allowed into classes, and they're recovering at home, and we have protected the schools, although still more are coming in because this is a disease that is spread very rapidly in our community. The schools have been very proactive, and they really are still the safest place to be for our kids. Moving on to vaccinations. Vaccines remain our best hope for returning to normal. This slide shows the difference in vaccinated in the blue line at the bottom versus unvaccinated cases. And you can see that there are 4 times more likely to be positive with COVID if they're unvaccinated. The next slide shows hospitalizations. If we can move to the next slide. And this also shows an increase in unvaccinated, 6 times more likely to be hospitalized than those who were vaccinated. And in the next slide, we show the mortality rate, and it's 17.8 times more likely to succumb to this disease if you're unvaccinated. So even though people talk about this being a mild disease, for those people who have it, it can be fatal, and it's very important. And even though there are more breakthroughs with the Omicron, with the vaccines, and also with vaccines waning more, there's a clear advantage to being vaccinated and boosted. There has been a lot of research lately about natural immunity versus vaccine immunity. In other words, natural immunity being post-infection. And the national studies show reinfection after COVID, even within 90 days, is 5 times more likely than an infection following vaccination. There's also a recent study that confirmed that, published in the CDC's MMWR, which looked at all the cases from California and New York, which was 18% of our population. And their conclusion is the safest strategy is still to vaccinate. Since January 8th, the average vaccination rate has actually been declining in California. Mendocino County has actually done a little better since January 6th, although we're again declining since January 13th. And I think we have a slide to show this. No, this shows the vaccination status in cases. I think we skipped over this slide. So on the very, no, let's go back to that just to show. In Mendocino County, those people who have been positive and have been unvaccinated are in the right, on the red bar all the way on the right. And the green bar next to that is the number of cases that have had vaccines. And so you can see that almost 90% of the cases are in the unvaccinated. And this is true for all of the age groups, basically. Now we can move on to the slides from Tableau. And as of this is where I was explaining that there is an increase actually of, the state has been decreasing since about the 8th, but Mendocino County did very well for a week, and our vaccination rolling average is similar to the state, so that's very good. We have distributed 144,524 vaccines, which accounts for 70.9% of eligible people in the county have been fully vaccinated. It also, on the next slide, we'll see this shows it by age, and we're actually better than California is the gray lines to the right. And as you look down, you can see where we are compared to the California average. And so we're behind the California average, except in those people over 65, where we actually exceed California's average vaccination rate. On the left part of this chart are the boosters. And we're doing very well with boosters in those people who are over 65. It's greater than 59% of that eligible population, although the others are less than 50%. The other thing to see here is that those people who are over 65, 88.4%. Well, 88.4% on another chart that includes the federal data. This is just the California state data. So the federal IHS data includes some other sources of vaccines, but we are 88.4% vaccinated in that age group. As far as boosters, remember they're encouraged now starting 5 months after the primary series, and they're also encouraged for our children from 12 to 15 years old. A question has been raised, can a person be eligible for 4 doses? And the answer is yes. This is a pretty frequent question on our call center. If a person has had their 2 primary series, one of the mRNA vaccines, Pfizer or Moderna, and they are immune compromised, they would be eligible for a 3rd shot 28 days later. And 5 months after that, they would be eligible for a booster. So some people should have 4 doses at this point to be up to date on their vaccines. We are making some changes in the dashboard and the website to alert you all about. They're planned. I don't think they're on quite yet. But what we will be doing is eliminating one table that duplicated the information that's already on the dashboard. And on another table, we've added a column of cases by region that shows the proportions. And so that percentage was important to add so people understood what's going on there. And on the dashboard, we removed the number of quarantined, and in there we will be putting an explanation that we're only really tracking confirmed cases, in other words, PCRs, because we have no way to really look at the antigen tests in this data. So in summary, the Omicron surge has been more severe than past in numbers of cases, hospitalizations, and soon we expect more mortality from that as well. While this variant may be less lethal, it is still lethal, especially for unvaccinated and vulnerable people. And the overwhelming numbers of cases and hospitalizations are severely threatening the health system as well as industry, with major numbers of absences. Epidemiologists and modelers are now saying Omicron has peaked in California, but not so in rural Northern California, which will lag by 2 to 3 weeks. My advice is protect yourself and your loved ones by avoiding higher risk activities, postpone travel for now, avoid large parties and gatherings, stay home if you're sick. The best defense is still to get vaccinated and boosted if you're eligible, and upgrade your masks. The federal government and some employers are now supplying these free. And finally, test. The over-the-counter antigen tests are available by mail from the federal government, and the county is trying to make them as available as possible. They are available through the school systems for the students. And with that, I'll close and open for questions.
Thank you, Dr. Coren. So the goal today is to get through at least 2 questions per outlet. We have 6 with us today. If you'd like to ask a follow-up question to clarify any information, please go ahead, but we'll just try and keep things brief and moving along so we can get to everybody. So let's begin with KMUD, KMUD. Oh, looks like we may have lost them. So let's move on to KZYX. Hopefully we'll get back.
I have no questions right now.
Great, thank you, KZYX. How about Mendocino Voice?
Hi, yes, thanks. I was wondering if Dr. Coren could provide any further information about the outbreak going on in the jail. I know during the last update, I think the numbers were 15 staff, and at that point, 2 inmates had tested positive via antigen tests. I don't know if you have any numbers or any further detail about the state of that outbreak currently.
Yeah, this, as you mentioned, this really started through the nursing staff. Altogether, as of today, we have had 20 staff affected. Only 4 are still on isolation. And this week we had a large number of inmates that tested positive. So the total of inmates went up to 62, but only 42 remain on isolation. And the jail is containing that very well, using a red zone for anyone who is positive, and the officers are using special PPE and changing it between areas when they move from one area to another area. So it did blossom into a very significant outbreak, and the jail staff is being very attentive to that. There have been no hospitalizations or severe illnesses that have happened so far at this point.
Okay, thanks. And can you just, clarify what a red zone is? Is that just a special medical area, or?
Well, what we've done with congregate living, mostly in skilled nursing facilities, has been to separate people who are positive with their COVID test into red zones. Those who are close contacts, we put them into yellow zones, and those who have been quarantined, or we know that they're not positive at this point, we call it green zone. And so that's where that terminology comes from.
Okay.
At this point, the jail is testing everybody, though.
Okay. I'm assuming with antigen tests?
Yes.
Okay, thanks.
Great, and let's move on to Periodico Al Punto.
Thank you. Dr. Coren, for people who had COVID 3 or 4 months ago, do you recommend to get tested with a PCR or an antigen rapid test?
If it's more than 3 months ago, they can go ahead and get tested with a PCR test. If it's less than 3 months, the PCR test may remain positive even though they're not contagious. So we recommend before 3 months to stay with antigen tests. Does that answer the question?
Yes, thank you.
Mhm.
There's information circulating that the variant Omicron is not serious as the other variants because the symptoms are similar to the flu or the cold. How dangerous is this variant and who can be affected more?
Well, first of all, it's probably not fair to compare it to the flu, which in a bad year would take 50,000 lives. And for the most part, I think the most recent flu year was 2019. It was only in the range of 20 or 25,000 lives. And as you can see, in the 2 years that we've had COVID, it has taken over 850,000 lives. Now, when you get down to Omicron, it does have different characteristics than, for example, Delta. And we look at various characteristics and their effect on individual people, but also society. So Omicron is very, very much more contagious than Delta. And that in and of itself is causing a huge rise in cases that we never saw with Delta and we don't see with the flu. And as a result, it is threatening our healthcare system. We're running out of not only intensive care unit beds, but many hospitals have no beds to put people in, and they're just what we call overflow. They stay in the emergency room, and in other hospitals down south, they can't even get the people in from ambulances to their emergency room. So it's caused a healthcare crisis. It is less virulent in the large numbers of people that we have affected. A smaller percentage wind up in the hospital or in the ICU or die compared to Delta. However, the huge numbers of cases mean that the numbers in the hospital are actually going up and will threaten the healthcare system. So this, when you use a word like severity, you can interpret it differently. When we look at it, from a public health point of view, it's not just the individual people's expression of the disease severity. It's, the virus has a certain characteristic called virulence, and this one is less virulent than Delta, but certainly much more than the influenza. And because of its contagiousness, it's terrible on our healthcare system, and it's threatening not only the people who have the illness, but people who might go to a hospital with a stroke or a broken leg or a heart attack or pneumonia, and they can't get care because the hospitals are just filled up. Does that answer your question, Jackie?
Yes, thank you, Dr. Coren.
All right, thank you. And excuse me, I should clarify that we'll go one question per outlet for like a round, and then we'll go for a second round. Also try and get public comment in. So let's move on to Mendo Fever.
Hi, first I'd like to say thank you for hosting this today. First question we have is we got a tip from a reader that there is a COVID-19 outbreak at Ukiah's Redwood Cove Health Center. What could you tell us about the extent of the outbreak and measures that are being taken to mitigate further cases?
They are having an outbreak at Redwood Cove, and they have divided their population into those zones I was talking about before. They're doing a good job. Because of their outbreak and its effect on the staff, it's my understanding that they're not admitting any new patients right now until they're over it. They've gotten help from their parent organization, and they're coping with it. So I don't have the most recent data. I think they're doing testing today, and we'll see how that's going.
Thank you.
Great, and then let's have Mendocino Action News.
Hello, this is Danella Sands. Dr. Coren, I want to know if you can go more into the long haul symptoms. We've heard from a lot of women that after they had COVID, they've experienced hair loss. And we've seen this up, to a year. Are there other long haul symptoms that you are hearing about? Is there a difference between women, men, and kids? And is there a difference between those vaccinated and not vaccinated long haul symptoms?
Those are all great questions, and I know that they're being investigated. I can tell you that it has been estimated between 20% and 80% of people who are sick could have some long haul symptoms. A lot depends still on what you define as long and symptoms that you would attribute. But the attributable symptoms that I've heard of so far include headache, brain fog, or sort of confused thinking, memory loss, other neurologic symptoms, longer coughs, some shortness of breath. Much of it is neurological, and it's just it's in the early stages of understanding this disease. But it is a concern because so many people seem to have it. They're defining it in some cases as after 1 month or after 3 months and some 6 months. So it takes a while for the scientific process to first define the disease and then to understand the symptoms and then to understand what are the causes of those symptoms. And we're not there yet. So I'm sorry I can't be more clear than that.
Okay. You have heard though about hair loss? I know you didn't mention that.
I haven't heard about hair loss. So this is the first time I've heard about that.
Okay. Thank you.
Great. And so KZYX, I wanted to check back in and see if you have any questions that have popped up.
Thank you. Yes. I'm wondering if you have an update on the genomic testing as to which variant people have. Are we just feeling like it's really likely that everyone has Omicron, or are there any ways of knowing if people still have lingering cases of previous variants, or if there's even any kind of early signs of the next variant heading our way?
It's a good question. So at this point in California, 95 to 99% of the sequencing that they're doing shows the Omicron variant. There have been 2 sublineages of that, but they do not look like they're turning into something that is either more prevalent, going to grow faster than Omicron, or have different symptoms. That may take a while to develop, but having so many cases of Omicron, it would not be surprising to have a case mutate and then grow from there. It would have to grow a lot faster than Omicron. And as you know, one of the characteristics of Omicron is its transmissibility and its contagiousness. And it would be hard to beat, but it certainly is possible. So as far as I know, there are no other emerging variants. They are looking worldwide, and I think that they may have discovered one. I think it was in France, but it didn't go anywhere. It was a few weeks ago, and it didn't grow. So attention is being paid to it, but it didn't have any different characteristics, and it seems to be fading, which is what most of the mutations do. As far as California goes, in the early weeks of of Omicron, there was some Delta mixed in, and they felt in Southern California and around the San Joaquin area that it was a mixed Omicron and Delta infection. But what's happened is they're looking at wastewater and they're looking at whole genome sequencing, and really at this point, it's pretty much Omicron.
And I have a quick follow-up. Is there any way of knowing how many of those tests have come out of Mendocino County or this region at least?
So we have this is a difficulty that we have in all of Northern California. We're smaller population. So when the folks in public health say we're trying to test 10%, and now they've dropped it because it's so much higher, 3 to 5% of all samples, we have a very small population. We have only been notified of 2 positive cases of Omicron in our county. But I think there have only been a total of 450 to 500 cases during the pandemic that have been sequenced. So it's not a lot.
Thank you.
Great, and let's take one question from the public now. So does the vaccine work for the new variants, or is it only for the first COVID-19? I feel it is not working as people are still getting sick even after being vaccinated and getting sicker.
It's a good question. So yes, it does work. And the 3 slides we showed before show the significant difference between people who get sick from or even get positive tests who have been vaccinated versus those who have not been vaccinated. Let me go back to that in a second. No, I don't think I can find it easily in my notes. It's in the range of people who are not vaccinated are 4 times more likely to have cases. People who are not vaccinated are 8 times more likely to wind up in the hospital, and people who are not vaccinated are 17 to 18 times more likely to wind up in the intensive care unit and to die. So it's very clear that the vaccines are very effective for people. There has been some waning of the efficacy of the vaccines. That happens with all vaccines over a period of time. And so we discovered a first set of vaccines very quickly and put them to the test. And now we're understanding that they only lasted a certain amount of time, or their effectiveness only lasted a certain amount of time, but they still lasted. And so now we're into boosters. That does not mean that they're not working or that they're not working as they intended to work. They're saving lives and they're saving hospitalizations, and they're, we think, also saving the possibility of people getting long COVID. Do people get infected even though they're vaccinated? Yes, nothing is 100%. And when you've got so many people getting exposed and infected, there are going to be some who have been vaccinated because now we have many more people vaccinated. So you're going to see those numbers rise. Do some of them wind up in the hospital or in the ICU or die? Yes, they do, unfortunately. Many more die who are not vaccinated. So it does again show that the vaccines are effective. And most of the people who have more serious infection from Omicron also have significant comorbidities. Not to say that Omicron doesn't make them worse, it does, but they get more serious disease with the Omicron because of their comorbidities. I hope that answered the question.
Thank you, Dr. Coren. So let's move into round 2 for some media questions and begin with Mendocino Voice.
Hi, thanks. So you mentioned that while the Omicron peak might have passed, or we might be a little bit beyond it statewide, Northern California may be a few weeks behind that. And I think the last time I did the math, there had been something like over 10% of the overall cases had occurred in the last week to 10 days or so of the counties, all the cases in Mendocino throughout the pandemic. We've had somewhere ballpark around 10% of those cases since New Year's. And so I was wondering if you could just maybe give us a picture of what we might expect that case count and the situation to look like locally over the next month or so, if we are not quite yet at our peak, and if those numbers are actually underreported.
Well, you know what? I'm going to just, if I can, go to the state site to help me with that. And see if we can paint a picture here. The forecasts. Let's look at the county. Now, these are forecasts, and what the state does to create this site is put many different models together, and they make a composite that they call an ensemble view. And if I can share my screen, I will show you let me see if I can, yeah, I can show you Mendocino County. And this is, so this is hospitalization forecasts. Let me see if I can get to, you. Yeah, so I don't have it for, let's see if I have, those are hospitalizations. So what I want to do is I want to see if I can find for the cases, and the closest I can get is R effective. So in our county, each person is still infecting more than one person. And so that's the R effective. We're in the range, I think, of 1 point, I wrote it down. Let's see if I can find that. So we are still, so on January 11th in Mendocino County, our R effective is 1.69. So for every person who got infected, and these are averages, they infected 1.7 other people. On the 19th, it had come down to 1.24. Today, it's 1.31. And I don't have a picture of that, but what I can show you, if you're interested, is the hospitalizations. And I can do that for this county, Mendocino. Okay, let me just put this on. Can I share this, Cam? Can I share my screen?
You should be able to.
Okay.
You have that green button in the middle.
Okay, good. Here we are. And I'm going to show you this slide. Can you see that?
Yes.
Okay, so you're seeing, again, January 16th. Here we are on the 21st. It's going up. It continues to look like it's going up. This is different than what we're seeing in some of the other counties. But again, as you get further out into February, the accuracy of those predictions drops off. And again, I'm looking at the dark blue line because it's a composite view of all these other projections. This dotted line or this dashed line that happens after January 16th separates the known data, and the projections are to the right of that. Let me show you another county that is probably coming down more. Let's go to San Francisco. I think that they're going down. Now you can see that they have gone up slightly, and they're going to peak here and come down, and you'll see that coming down. If we look at, not so sure it makes sense to go through too much of this, but you get the point that basically we are approaching a point where we'll see a shoulder and then a peak, and then it'll come down. And we haven't gotten that far yet in Northern California, and certainly not in Mendocino County.
Okay, so just if I'm understanding that ensemble graph correctly, that's projecting cases to continue to rise past the middle of February, and then it kind of didn't give a projection beyond that.
Right, and the graph I'm showing you is hospitalizations will continue to go up.
Okay.
That's what I showed you. I can't find the other charts that I have. Projections of cases are really not as simple and easy to read. They're much more complex scenarios. So I don't think it makes sense to flash that up on in this situation.
Okay, but certainly, even though maybe patients will be able to be transferred out of region, it's reasonable to expect that strain on local, staff and hospital capacity is likely to continue as such or increase over the next couple weeks.
Yeah, so that's hospitalizations that are going up. We hope that by early mid-February, our case rates will peak. So that's about 2 to 3 weeks out. And then after that, hospitalizations will peak. And this graph that I showed you with the dark blue line doesn't really show hospitalizations coming down. Note that we have 2 patients in our Mendocino hospitals from out of county. And so other relatively close, I won't say neighboring counties, I don't know exactly where they're from, but I think they're from Central California, are already sending us their cases because they're filled. And so how long will that last? I can't really tell you. Usually hospitalizations follow 2 weeks or so after we see cases rise, and they should follow a few weeks after that. And then deaths also rise a few weeks after the hospitalizations rise, and they come down over the next month. The rate.
Okay, thanks.
So we've got another month to a month and a half of this Omicron with us, and it's still a very big concern.
Great, thank you. Let's move on to Mendo Fever.
Hi. So Dr. Fauci described the need to start using different metrics to measure the pandemic status, specifically pointing towards hospital rates as a more accurate barometer of the pandemic severity, since we are on that topic. What are your thoughts on this proposed change, and do you think the daily cases are the right numbers to give an accurate picture?
I think Dr. Fauci is looking at it from a slightly different point of view. It's very hard to measure and keep using cases because the expectation is that it surged so quickly. The numbers went up almost in a vertical line in most places. And they seem, when we look at the states and the countries where they've come down, like they're coming down very rapidly also. And that doesn't really represent what the effect is going to be with hospitalizations, because that will, people will have that starting a couple of 2-3 weeks after the surge in cases. And then it takes a little longer for those people who are in the hospital to be discharged from the hospital. And then some will stay in the ICU and some will pass away. So it's just sometimes easier to look at a slower growth than it is to a really rapid growth like we've seen with cases. And I think that's more what he's referring to.
Thank you.
All right, thank you. And let's move on to Mendocino Action News.
Right, hello again. So, Dr. Coren, in the past, you've given us an honest update about vaccines, side effects they're still researching, and some that came ahead. Some things with young men, teenager men, there was a small amount side effect there. And then men and women with the Johnson & Johnson vaccine, you talked about that. Now that we're giving vaccines to 5 to 11-year-olds a little bit more, have you seen anything significant there that people be aware of, or just keep in mind or watch those that are wanting to get vaccines for their children?
That's a good question. So there have been given out millions of these vaccines. There is less side effects that they're reporting even during the vaccines and after the vaccines. They're seeing much less side effects than we worried about in the young teenage boys, for example, who seem to be more susceptible to the pericarditis, myocarditis. Now remember that in the teenage boys, they are more susceptible to myocarditis, pericarditis, even without COVID, because it comes along with many other viral illnesses. And the recovery is brief, and the severity is actually very small. However, the myocarditis, pericarditis from COVID is much, much more severe. So I think I've gotten off a little bit from your question. I think you were asking, are we seeing more or different side effect profile for the vaccines in the youngest children that we're starting to vaccinate, the 5 to 11? And the answer to that is no. It's actually going very, very well. It's very safe, and we're not seeing any unusual or even the old side effects that we saw in some other groups. We're just not seeing that hardly at all. I'm not aware of any.
Thank you.
All right, and let's move on to periodico al punto.
Hi. We have a question that our audience always ask. How long should a person wait to get vaccinated after having been infected with COVID?
It's a good question. So they're still having some inflammatory symptoms even after a couple of weeks. And so I usually recommend they can get it right after they're finished their isolation period. But I would wait another week or so, make sure all the symptoms are gone, and then go ahead and get the vaccine. I think that would be the safest way to do it.
Thank you.
All right, and KZYX.
Yes, I'm wondering if you have any advice about the new CDC guidance, or I think it's a week old at this point, about workers having to take a test that can no longer be self-administered and self-read. This is obviously a rapid test, and that employers need to give workers some time off to take these tests. And so obviously the tests are playing a large role in people making a decision as to whether it's safe for them to get back to work or not, but the tests still seem to be in fairly short supply. So what guidance would you give to employees and businesses if an employee thinks they might have been exposed, they have a fever, they have symptoms, but the rapid test is negative, and we know that a lot of the rapid tests don't have correct results? What kind of guidance should people have about going to work in the absence of quick rapid tests?
So if people are symptomatic, they should stay home. They should wait until the fever's gone and their symptoms are resolving. If they have they should get a COVID test at that point. If it's negative and they have those symptoms, I would advise they get another COVID test, probably a day or two later.
And so you mean like taking serial rapid tests?
Yeah, not serial, not for a lot, but you could repeat it again. Sometimes it'll be negative in the very earliest stage of the disease. And so waiting another day or two, the incubation period for Omicron is very, very short. But still, a person may be sensitive or get the infection in a certain area that they feel it more and they kind of know that they're sick. If you're sick, stay home. Don't risk it. And get a test. If the test is negative, then we call that a discordant test. And so you can test that either with a PCR, which is a little more sensitive. And if you haven't had another infection within the last 3 months, a PCR is a very good way to test those discordant results. But if you don't have one around and those take a long time to come back, then repeating an antigen test in another day or two makes sense. And during that day or two, hopefully the symptoms will resolve. And if it's negative, then they didn't have the illness. They could go to their own personal provider, and a provider could do that test, or they may give them other advice. As far as coming back to work and getting an employer observed or a provider observed test before you come back, that's an OSHA rule, and the employers have to follow those rules. So I'm not going to comment on them. OSHA has followed the CDPH guidance since about a month or so ago, and they reclarified it for workplace restrictions. But there are some differences between what CDPH requires and what Cal OSHA, the Emergency Temporary Standards, requires, and they're not all exactly the same. But the employers need to know them because they're responsible for them.
Right, and if they can't get the rapid test, if they're just not available, they should. The rule of thumb is just stay home if you're symptomatic.
Absolutely.
All right, thank you.
All right, and let's take a question from the public. Actually, we've had a number of questions on Facebook. I think more than 30 comments, and a common theme has been now that we're 2 years into the pandemic, can you speak a little bit as to why the current mask and business restrictions are still necessary?
The masks are the most effective, most available, least expensive way to prevent upper respiratory diseases from spreading. And we are, even though 2 years have passed, we are still learning. And I don't mean me personally, because I'm, I'm of course learning, but the whole scientific community is learning about this disease. I mean, we may take vaccines for granted because they've been around for a long time and they've been very effective, but it took a long time to identify the diseases that made sense to vaccinate against, how to vaccinate, what vaccines, which needed boosters. When I was when I was in my medical training just 40 years ago, one tetanus shot, your series of tetanus shots when you were a child, and one tetanus shot was as a booster sometime was enough to protect you against tetanus. Well, that changed, and it changed to once every 10 years you should have another one. There have been other changes as well. So we're very much in a learning curve about this. And we see some of the efficacy of the vaccines wearing off, and so there have to be updated vaccine strategies, and we'll continue to be learning and improving. Hopefully, we'll have a vaccine that that responds to any of the COVID variants. That's not true with influenza; they do change them every year. But they're able to predict which ones are the likely variants in influenza to put in the new vaccines each year, and they've added usually 3 or 4 different varieties or variant types in the influenza vaccines. We're still babies at learning about this, and so for me to say when or give some advice, I wouldn't begin to do that. You just have to be humble and say, nature has us outwitted and we're trying to figure our way out of this box. And so in the meantime, we want to keep as many people healthy and out of the hospital. And it is, it's a big problem. It's a big problem for each individual and for the businesses as well. The business restrictions have decreased quite a bit since a year ago. And I think that should be appreciated as we learn more. We want to relax the restrictions. The same thing has been true of schools. We've learned more in that first couple of years, so we can now safely open schools, and contact investigation, contact tracing can be done pretty much at the school site in Mendocino County. So we're learning as we go, but we certainly do not know it all. And I would be the last to say we do, or that I have the answers. We're in a learning phase.
Okay, thank you, Dr. Coren. And we're just 2 minutes to 3 o'clock, so I will pass it right back to you if you have any closing comments.
No, I think I would say, as I said before, Omicron may be peaking, but in Mendocino County, it looks like it'll take another 2 or 3 weeks. So I would not go by the general, explanations about the state or the country. Those we look at those to learn from those experiences. We do want to, in the meantime, make sure everyone stays safe. And so, especially now in Mendocino County, while we are still in the midst of this Omicron surge, it is prudent to avoid the high-risk activities like the large gatherings and parties, travel. For sure, if you're sick, stay home, get tested, and keep yourself masked with the upgraded masks now. And the best defense is still to get vaccinated, and if vaccinated, get boosted as soon as it's your time. And let's hang together as a community, and we will get through this.
All right. Well, thank you, Dr. Coren. Thank you, everyone who participated and listened in today. The next one on the schedule is Friday, February 4th. That's 2 more weeks. In the meantime, you can get any updates on Mendocino County's public health webpage or Facebook page. So we hope you all have a great weekend. Thanks again.
Thank you.